ಭಾರತದ ಪ್ರಮುಖ ಮಲ್ಟಿ ಸೂಪರ್ ಸ್ಪೆಷಾಲಿಟಿ ಕ್ವಾಟರ್ನರಿ ಕೇರ್ ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ ಒಂದಾದ ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಹಾಸ್ಪಿಟಲ್ ಇಂದು ನ್ಯೂಯಾರ್ಕ್ ಮೂಲದ ಮೌಂಟ್ ಸಿನೈ ಹೆಲ್ತ್ ಸಿಸ್ಟಮ್ ಜೊತೆಗೆ ಒಂದು ಒಪ್ಪಂದಕ್ಕೆ ಸಹಿ ಮಾಡಿದೆ. ಬದಲಾವಣೆಯ ನಿಟ್ಟಿನಲ್ಲಿ ಇದೊಂದು ಮಹತ್ವದ ಸಹಭಾಗಿತ್ವ ಆಗಿದ್ದು, ಆರೋಗ್ಯ ರಕ್ಷಣಾ ಸೇವೆಗಳನ್ನು ಇನ್ನೂ ಉನ್ನತ ಮಟ್ಟಕ್ಕೆ ಒಯ್ಯುವ ಗುರಿಯನ್ನು ಹೊಂದಿದೆ. ಈ ಒಪ್ಪಂದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಇಂದು ಕರೆಯಲಾಗಿದ್ದ ಪತ್ರಿಕಾಗೋಷ್ಠಿಯಲ್ಲಿ ಗೋಕುಲ ಶಿಕ್ಷಣ ಸಂಸ್ಥೆಯ ಚೇರ್ಮನ್ ಡಾಕ್ಟರ್ ಎಂ.ಆರ್. ಜಯರಾಮ್, ವೈದ್ಯಕೀಯ ಮುಖ್ಯಾಧಿಕಾರಿ ಎಂ.ಆರ್. ಶ್ರೀನಿವಾಸಮೂರ್ತಿ, ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಆಸ್ಪತ್ರೆಯ ಅಧ್ಯಕ್ಷ ಡಾಕ್ಟರ್ ಎಸ್.ಸಿ. ನಾಗೇಂದ್ರಸ್ವಾಮಿ ಮತ್ತು ನ್ಯೂಯಾರ್ಕ್ ಮೂಲದ ಮೌಂಟ್ ಸಿನೈ ಹೆಲ್ತ್ ಸಿಸ್ಟಂನ ಅಧ್ಯಕ್ಷ ಡಾಕ್ಟರ್ ಡೆಬಿ ಡೊರೊಟೊವಿಕ್ಸ್ ಮತ್ತು ಡಾಕ್ಟರ್ ಡೆವಿಲ್ ಎಲ್ ರೀಚ್ ಸೇರಿದಂತೆ ಹಲವಾರು ಭಾಗಿಯಾಗಿದ್ದರು.
Today we are having the celebration, the launch of a very important international collaboration that Ramaiah Memorial Hospital is entering into with the famous Mount Sinai Hospital, Mount Sinai International Health System in New York. We have with us Dr. Dorotovics, Sabi Dorotovics, Dr. David Reach, Mr. Gianelli, Dr. Sharma, all of them representing the Mount Sinai International Hospital. Of course, you know our Honorable Chairman, Dr. M.R. Jairam. We will briefly explain to you the contours of the international collaboration that we have entered into. Last year, we began this process of negotiating a collaboration deal with Mount Sinai International. The intention was to see that our Ramaiah Memorial Hospital sets up a number of centers of excellence in various super specialties with the help of a very well-known, highly reputed healthcare system of the Mount Sinai International in New York.
I'd like to start with stating that our leadership at Mount Sinai Health System in New York is very proud and honored to be able to form this long-term partnership with Ramaiah, because Ramaiah and Mount Sinai shares a common mission of finding ways to best serve our patients, provide best quality care, and strive for the best outcome. In that quest, we forged this relationship to establish and help improve healthcare processes, clinical care processes in multiple specialties, including cardiovascular care, oncology, and other areas. Our history in New York City is exactly that. We are not only a major healthcare provider in the city, but we are one of the top academic medical centers in New York, in the United States.
ಈ ಸಂದರ್ಭದಲ್ಲಿ ಮಾತನಾಡಿದ ಡಾಕ್ಟರ್ ಎಂ.ಆರ್. ಜಯರಾಮ್, ದೇಶದ ನಾನಾ ಮೂಲೆಗಳಿಂದ ಚಿಕಿತ್ಸೆಗಾಗಿ ಜನರು ಬರುತ್ತಿದ್ದು, ಈ ಒಪ್ಪಂದದ ನಂತರ ಮತ್ತಷ್ಟು ಜನರು ಇದರ ಉಪಯೋಗ ಪಡೆದುಕೊಳ್ಳಲಿದ್ದಾರೆ ಎಂದರು.
Patients are coming from Africa.
90% of them are
yes, most of them are coming from Africa now. But you see, it's a question of wherever, see, it's all about economics. If they can afford, anybody can afford, they would like to come and take it. But a center, if it can give, the best of treatment, and that's what it makes people to come in. So from wherever it may be, so they may be able to come. But first of all, let us talk about our own people. So what we are looking at is this collaboration or this hand-holding the area that we have now come to an agreement is the whole of South India and the whole of our eastern India, starting from Bengal onwards. So these are the two areas that we have taken. So as we improve and as we go on along, we may extend this to other areas also. But basically, because we see from Andhra Pradesh, lots of people are coming to our hospital, especially for super specialties, for cardiology or oncology. There's a tremendous, the need for them to come here and take, because they are just our neighbors. Close by. So they are able to come, and even from people from nearer places from Tamil Nadu, Hosur and this, they are the people where they would like to come and have it. So we have extended this to whole of South India, And as we go on, and also the people are now, see, Bangalore has become a center for the eastern region. Most of the people are coming to Bangalore from the whole of Bengal and Assam and of these areas, because it is for them, it is one is they feel that they are secured, the good healthcare system is very good here, and it is affordable. So there are things where now Karnataka has been able to project. So we would like to project that, and if people are going to come from other places, yes, welcome to it.
ವೈದ್ಯಕೀಯ ಮುಖ್ಯಾಧಿಕಾರಿ ಎಂ.ಆರ್. ಶ್ರೀನಿವಾಸಮೂರ್ತಿ ಮಾತನಾಡಿ, ಈ ಒಪ್ಪಂದವು ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಹೇಗೆ ಕಾರ್ಯಗತವಾಗುವುದು ಎಂಬುದನ್ನು ತಿಳಿಸಿದರು.
ಒಂದು ಸಹಯೋಗವನ್ನು ಈ ದಿವಸ ನಾವು ಪ್ರಾರಂಭ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಇದರ ಅಡಿಯಲ್ಲಿ ಮುಂದಿನ 10 ವರ್ಷಗಳ ಕಾಲ ಎರಡೂ ಆಸ್ಪತ್ರೆಗಳು ಅಲ್ಲಿರುವ ವೈದ್ಯರು ಮತ್ತು ನಮ್ಮಲ್ಲಿರುವ ವೈದ್ಯರು ಪರಸ್ಪರ ಚರ್ಚೆ ಮಾಡಿ ಇಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ರೋಗಿಗಳಿಗೆ ಉತ್ತಮವಾಗಿರ್ತಕ್ಕಂಥ ಆರೈಕೆಯನ್ನು ಕೊಡುವುದು ಹೇಗೆ ಮತ್ತು ಇತ್ತೀಚಿನ ತಂತ್ರಜ್ಞಾನ ಏನಿದೆ ಆಧುನಿಕ ತಂತ್ರಜ್ಞಾನ ಅದನ್ನು ಸಹ ಬಳಸ್ಕೊಳ್ಳುವುದು ಹೇಗೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಪರಸ್ಪರ ವಿಚಾರ ವಿನಿಮಯ ಮಾಡಿಕೊಳ್ತಾ ಇರ್ತಾರೆ. ನಮ್ಮ ಸಿಬ್ಬಂದಿಯು ಮೌಂಟ್ ಸೈನೈ ಆಸ್ಪತ್ರೆಗೆ ಭೇಟಿ ನೀಡ್ತದೆ ಮತ್ತು ಅಲ್ಲಿಯವರು ಸಹ ಇಲ್ಲಿ ಭೇಟಿ ನೀಡಿ ಆಗಾಗ ನಮ್ಮ ಸಿಬ್ಬಂದಿಯನ್ನು ತರಬೇತಿ ಮಾಡುವುದು ಮತ್ತು ಅವರ ಸಂಶೋಧನೆಗಳಲ್ಲಿ ನಾವು ಭಾಗವಹಿಸುವುದು ಈ ಒಂದು ಸಹಯೋಗದ ಭಾಗವಾಗಿರುತ್ತದೆ.
ಪತ್ರಿಕಾಗೋಷ್ಠಿಯ ನಂತರ ನಡೆದ ಒಪ್ಪಂದ ಸಮಾರಂಭದಲ್ಲಿ ಕೇಂದ್ರ ಸಚಿವ ಪ್ರಹ್ಲಾದ್ ಜೋಶಿ, ಕರ್ನಾಟಕ ಸರ್ಕಾರದ ಆರೋಗ್ಯ ಸಚಿವ ಆರ್. ದಿನೇಶ್ ಗುಂಡೂರಾವ್, ಗೋಕುಲ ಶಿಕ್ಷಣ ಸಂಸ್ಥೆಯ ಚೇರ್ಮನ್ ಡಾಕ್ಟರ್ ಎಂ.ಆರ್. ಜಯರಾಮ್, ವೈದ್ಯಕೀಯ ಮುಖ್ಯಾಧಿಕಾರಿ ಎಂ.ಆರ್. ಶ್ರೀನಿವಾಸಮೂರ್ತಿ, ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಆಸ್ಪತ್ರೆಯ ಅಧ್ಯಕ್ಷ ಡಾಕ್ಟರ್ ಎಸ್.ಸಿ. ನಾಗೇಂದ್ರಸ್ವಾಮಿ ಮತ್ತು ನ್ಯೂಯಾರ್ಕ್ ಮೂಲದ ಮೌಂಟ್ ಸಿನೈ ಹೆಲ್ತ್ ಸಿಸ್ಟಂನ ಅಧ್ಯಕ್ಷ ಡಾಕ್ಟರ್ ಗೆಬಿ ಡೊರೊಟೋವಿಕ್ಸ್ ಮತ್ತು ಡಾಕ್ಟರ್ ಡೆವಿಲ್ ಎಲ್ ರೀಚ್ ಸೇರಿದಂತೆ ಹಲವಾರು ಗಣ್ಯರು ಭಾಗಿಯಾಗಿದ್ದರು.
Today is the red letter day of two important institutions, the Ramaiah Memorial Hospital and the Mount Sinai Hospital, New York, coming together. I would like to pause here, briefly reflect the past, the present and the future. This institution was started in the year 1960 by my beloved father. He established the Gokula Education Foundation. We have celebrated the Diamond Jubilee very recently. The first institution was the Ramaiah Institute of Technology. Then the number of institutions started, and most important milestones were the medical college was started in 1979. The Ramaiah Teaching Hospital was started in the year 1984. The Ramaiah Memorial Hospital was started in 2004, and it became a university. Ramaiah University of Applied Sciences was started in the year 2014.
And we are honored and privileged to work with them. I learned that just over 2 weeks ago, Bangalore celebrated the 514th birthday of the legendary founder, Kempegoda. Famous for his visionary societal reforms and tremendous contributions to building the city, he was, and he is still remembered today, for helping the citizens of Bengaluru enhance their prosperity. It is in this spirit of Bengaluru's founder that Mount Sinai and Ramaiah forged our long-term collaboration. Together, we seek to provide citizens with the highest international standards of healthcare and thereby enhance their wellness and prosperity. Mount Sinai and Ramaiah are particularly well suited to such a collective mission due to our shared characteristics. First, we both have a long history of being a leading healthcare institution in our home cities and indeed within our home countries. We have also highly reputable medical schools and share a commitment to medical education, innovation, and clinical excellence. We also share an unwavering dedication to our patients and their families and always strive to provide the highest quality care. At Mount Sinai, our mantra is, "We find a way." This simple phrase reflects our mission to reject complacency and convention by always seeking the best and most innovative ways to treat, cure, and maintain the long-term wellness of our patients.
It gives me great pleasure to be here because this is a wonderful occasion. I think simply put, two great institutions are coming together, and I think Mount Sinai could not have found a better partner than MS Ramaiah to start this initiative. MS Ramaiah is an iconic institution of Karnataka, and not only in Karnataka, it's known across the country because they were the pioneers in medical education long ago. And people from all over India, they used to come to this institution to study. And there used to always be a competition, a beeline to somehow make it to this institution. So this institution has built up its reputation over a period of more than 40, 50 years now, more than 40 years. And it's thanks to the visionary leadership, of course, of Mr. MS Ramaiah, the late MS Ramaiah, who from being a civil contractor became a great educationist. And his legacy has been ably continued by his children. And now I think his grandchildren also are taking it forward. So it is a India-renowned institution, known for its quality of education, known for its quality of treatment. And it's a matter of great pride for us that this partnership is happening. Of course, when we heard Mr. Jairam speak, I think we could understand why this institution has become so great.
I would like to tell the office bearers of the Mount Sinai Hospital, the MS Ramaiah was a great philanthropist, and this medical college was started in a private sector when there was a very dearth of the medical colleges, medical seats in Karnataka as well as in India. At that time it was started. From all over India, people used to come to this institute for this hospital, and they are also running the hospital. Few beds they have kept it for the poor people. They used to treat poor people freely from those days when it was very costly. So that is the philosophy of Sri MS Ramaiah, and Sri Jairam has continued it in the same manner That's why we have so much respect and regards for him. And also I would like to tell, yours is one of the best sixth hospital in US. But if you take MS Ramaiah Institute only in private sector, other than AIMS and other things, MS Ramaiah College may rank around 6th or 7th in India. If you all put together, if you calculate, if you consider all other government institution, All India Institute of Medical Science and such things, then their rank may little be go up, but otherwise in the private sector itself, their ranking may be around 7th or 8th, I believe. Correct, na? Yeah. And that's why this is a mutual benefit. Mutual benefit as far as your R&D is quite good, in the entire US it is quite good, and in your hospital also it is good. And yours is the 6th best institute in the world, I mean in the United States, and 21st best hospital in the entire world.